So I'm going to be giving you 5 main features that will tell you if the lump in your armpit, your neck, breast, testicles or groin could be suspicious or possibly cancer. 1. When feeling a lump, is it soft or is it hard? A rock-hard lump is unlikely to be a cyst or lipoma or a benign lymph node. Understand the difference between firm and hard. With firm, you can still push the lump with some give, but a hard lump is rock-hard like a stone. You just cannot push a hard lump. 2. Is the lump fixed or mobile? A benign lump, such as a lipoma or a cyst, tends to be more mobile and have more movement than a cancerous lump, which tends to be more attached to the tissue. 3. Is the lump getting bigger? A cyst will tend to fluctuate in size. Sometimes it gets smaller, sometimes it gets bigger. A lipoma can stay the same size and it can get bigger, but over a longer period of time, while a cancerous lump is more likely to grow in size within a short period of time, i.e. weeks or months. But you have to put this in context with other changes that you notice, as some cancerous lumps do not always necessarily get bigger or big enough that they might be noticeable to you. Also, could your mind be playing tricks on you? One day it feels big, the next day it feels small. Is it the same size? This is why it's always important to get it checked. 4. Is the lump irregular? Cysts and lipomas tend to be smooth and regular. Benign lymph nodes have a P shape, while cancerous lumps tend to be more irregular in shape, and they do not have the same nice smooth border that you'd normally expect with a benign lump. 5. Is the lump persistent? A new lump that has suddenly appeared and does not seem to go away within 6 weeks should always be checked out. Could it be an infection, a boil, cyst, lipoma, or a lymph node that has appeared due to an infection or trauma, but they tend to regress within 6 weeks? So a persistent lump that is fixed, getting bigger and irregular should not be ignored. Now, other symptoms to look out for with a lump are night sweats, fatigue, weight loss of appetite, aches and pains. And this shall prompt your doctor to examine you and do other blood tests such as full blood count, inflammatory markers, a scan of the area, and if needed, a biopsy of the lump. So if you have any concerns about a lump, if it's persistent, if it is fixed, if it's getting bigger, if it's irregular, if it's hard to touch, then please see a doctor.